No one talks about it openly, but every man notices when it stops. That quiet moment in the morning when something that used to be automatic just doesn't happen anymore. No morning wood. It's not just about aging. It's a signal your body is sending, and ignoring it could cost you more than you think. Here's the truth. A missing morning erection is not normal. It's a red flag. It can point to hormonal imbalance, poor circulation, or even the early stages of heart disease. And most men don't find out until it's too late. But here's the good news. You can fix it. Naturally. No pills. No embarrassment. In this video, you'll discover why your morning erections have faded and the 4 steps to bring them back fast. You'll learn how to restore your testosterone, improve your sleep, and use your erection patterns as a vital sign of long-term health. It's not about performance. It's about prevention. Subscribe to the channel now to unlock the tools, science, and support you need to reclaim your vitality. Morning erections are not simply about arousal. They are biological signals of deep internal health. During REM sleep, when the brain is most active, a man's body undergoes spontaneous penile erections. This isn't triggered by dreams or desire, but by reflexes governed by the parasympathetic nervous system. These nocturnal events act as functional tests for 3 vital systems: vascular, neurological, and hormonal. If blood is flowing well, nerves are responsive, and hormones are balanced, the penis will naturally respond. In this way, morning wood becomes a daily status report on how well your internal systems are working. In healthy men, even into their 70s or 80s, these erections occur multiple times each night. They are part of the body's self-maintenance, helping preserve penile tissue and oxygenation. When they vanish, it's rarely just aging. It usually signals something deeper that's worth understanding. So while it may seem like a trivial or private matter, morning erections are far more than they appear. They are one of the most accessible, visible signs of physiological balance, offering insights into sleep, hormone health, circulation, and overall male function. Losing morning erections isn't random. It's often a reflection of deeper imbalances. One of the most common culprits is low testosterone. As men age, especially past 40, testosterone levels can decline steadily. This hormone plays a key role in triggering nocturnal erections, and its absence is often the first red flag. Poor sleep quality is another major factor. Morning wood depends on healthy REM cycles, and anything that disrupts deep sleep, like snoring, sleep apnea, or inconsistent bedtimes, can block the signals needed for an erection. Even blue light from screens or late caffeine can interfere more than most realize. Chronic stress also takes a toll. Elevated cortisol levels, especially when persistent, interfere with testosterone production and blood flow. Stress constricts the vessels and shifts the body into survival mode, where libido and sexual function take a backseat. Underlying circulatory problems or early signs of heart disease may also be to blame. Because the blood vessels in the penis are small and sensitive, they often show dysfunction before the heart does. Add in factors like obesity or insulin resistance, and the system gets further out of sync, reducing the chance of a strong erection in the morning. Erections during sleep are closely tied to the REM cycle, the deepest and most restorative stage of sleep. During REM, the brain activates systems responsible for muscle relaxation, hormonal pulses, and penile tumescence. If this cycle is cut short or inconsistent, the body misses its natural window to trigger these functions. Snoring or sleep apnea are 2 of the most disruptive forces. Both fragment sleep and reduce the time spent in REM. That means fewer opportunities for the body to produce nighttime erections. Left unchecked, these issues can reduce testosterone and strain cardiovascular health, compounding the problem. Blue light from screens, especially within 2 hours of bedtime, suppresses melatonin production and delays REM onset. This not only shifts the body's circadian rhythm but also robs it of the deep stages required for hormonal balance and vascular relaxation, both critical for erectile health. Even caffeine, if consumed late in the day, can subtly impair sleep cycles. For men over 40, sensitivity to these disruptors tends to increase. Protecting sleep is not just about feeling rested. It's about restoring the body's capacity to perform its internal maintenance, including sexual function. Testosterone is the most recognized hormone in male sexual health, but it's far from the only player. During sleep, particularly in the early morning hours, the body releases pulses of testosterone that help initiate and sustain nocturnal erections. When levels are low, these signals weaken, and morningwood becomes rare or absent. Other hormones also contribute to erectile function. DHEA supports libido and vascular health. LH, luteinizing hormone, and FSH, follicle-stimulating hormone, regulate testosterone production in the testes. Growth hormone, released in deep sleep, aids tissue repair and boosts overall vitality. Disruptions in any of these pathways can interfere with sexual function. Knowing your lab numbers is essential. Healthy testosterone levels typically range from 600 to 900 DL in the morning. DHEAS should stay within age-appropriate ranges, and LH-FSH levels can reveal whether your testosterone drop is due to testicular or brain-level issues. A full panel offers a clearer picture than testosterone alone. For men over 50, subtle hormonal declines may seem normal, but they don't have to be accepted as inevitable. By testing and tracking these markers, you gain the insight needed to take action early, restore hormonal balance, and protect long-term sexual vitality. Many men are surprised to learn that their erection patterns, especially morning erections, can reveal early signs of heart trouble. The blood vessels in the penis are smaller and more sensitive than those in the heart. That means reduced blood flow often shows up here first, long before symptoms like chest pain appear. Endothelial function is the key. The endothelium is the lining of blood vessels, responsible for releasing nitric oxide, which helps relax arteries and allow blood to flow. If this function is impaired, erections become weaker or disappear, especially during sleep when no psychological factors are involved. This is why a decline in morning erections is more than a sexual issue. It can be a silent warning sign of vascular dysfunction, prediabetes, or early stages of coronary artery disease. Doctors now recognize that erectile issues are often predictive of future cardiovascular events within 3 to 5 years. For men over 50, tracking erection quality isn't about ego, it's about prevention. If morningwood becomes less frequent or vanishes, it's worth investigating your heart health, not just your hormones. Addressing it early could prevent far more serious outcomes down the road. Restoring morning erections starts with reclaiming your health from the inside out. Strength training and daily walking are two of the most effective ways to boost testosterone, improve blood flow, and reduce insulin resistance, all key players in erectile function. Just 30 minutes a day can yield noticeable changes within weeks. Cutting out sugar and alcohol is another powerful step. Excess sugar disrupts hormonal balance and damages blood vessels, while alcohol suppresses testosterone and interferes with REM sleep. Eliminating or reducing both helps restore your body's natural rhythm and repair mechanisms. Eating healthy fats, especially omega-3s from fish, flaxseed, or walnuts, and monounsaturated fats like olive oil, supports hormone production and cardiovascular health. These fats act as building blocks for testosterone and help reduce inflammation, which often interferes with blood flow. Lastly, sleep hygiene is essential. Sleep in complete darkness, reduce screen time before bed, and keep your bedroom cool and quiet. Supplementing with zinc, magnesium, or vitamin D, if deficient, can support hormone production and recovery. These are practical, sustainable strategies any man can implement today to bring back the body's natural signals. Paying attention to your morning erections is more than a curiosity. It's a valuable self-assessment tool. Start by tracking their frequency over 30 days. A healthy pattern is 3 to 5 times per week. If you're down to once a week or less for several months, it's time to investigate further. Use a simple log or a digital tracker to record presence, duration, and quality. This gives you objective data that can help your doctor identify trends. If you notice a consistent decline, it may indicate hormonal imbalance, sleep disruption, or emerging vascular issues. When the pattern is concerning, lab testing becomes essential. Begin with total and free testosterone, but don't stop there. Add DHEA, estradiol, LH, FSH, and prolactin to see the full hormonal landscape. Also consider testing fasting glucose, A1C, and lipid panels to rule out metabolic or cardiovascular contributors. Consult a urologist or endocrinologist if morning erections disappear completely, or if they are accompanied by other symptoms like fatigue, mood changes, or low libido. These specialists can guide you toward deeper evaluations and long-term solutions before small problems become major health concerns. Morning erections should be treated like any other vital sign, as important as your blood pressure or resting heart rate. They offer real-time feedback on your sleep quality, hormonal health, nervous system, and vascular function. Ignoring them means missing out on early warnings your body is trying to send. For men over 50, this becomes even more critical. Sexual health is not separate from overall health, it's a reflection of it. Tracking and maintaining morning erections reinforces a daily awareness of what's working in your lifestyle and what needs adjustment. It's not vanity, it's vigilance. Use this feedback loop to adjust habits. Are you sleeping well? Managing stress? Staying active? Eating in a way that supports hormone balance? One signal in the morning can reflect dozens of choices made the day before and guide better ones moving forward. Reframing erections as part of your daily health audit shifts the focus from performance to prevention. It puts you back in control, not just of your bedroom confidence, but of your long-term vitality. And that, more than any quick fix, is what builds strength that lasts. Join our members club today for insider tips, early access to expert interviews, and exclusive tools to monitor and restore your sexual health naturally. If you're waking up without morning erections, don't brush it off. It's not just about age, and it's certainly not about shame. It's your body giving you a clear message, one that could protect your energy, your hormones, and even your heart. Start treating your sexual health like the critical sign of well-being it truly is. Track it, test it, improve it with the daily strategies we shared. And remember, no change will happen until you take that first step. Now, I want to hear from you. When was the last time you tracked your morning health? Drop a comment below. If this helped you, give it a like, share it with someone who needs it, and don't forget to subscribe and turn on notifications. Your health depends on it.